Dietary Guidelines for Americans, 25, 2013. The new dietary guidelines were released on January 7th, 2026, and it was released by the U.S. Department of Agriculture and the Department of Health and Human Services. The guidelines are released every 5 years. The first edition was published in 1980. The main target group is health professionals and policy makers. And this aims to help them develop, implement, and evaluate federal food, nutrition, and health policies and programs, as well as to design federal nutrition education materials for the public, as well as USDA and Health and Human Services nutrition programs. Other uses. The guidelines also aid state and local governments, schools, the food industry, community groups, the media, etc., in developing programs, policies, and messages for the public. The guidelines have several aims. One, eat quote unquote real food. Two, prioritize diets built on whole, nutrient dense foods that are high in protein, dairy, vegetables, and fruits. And to shift the food system to prevent chronic diseases. The diseases that are of concerns to Americans include heart disease, type 2 diabetes, hypertension, and overweight and obesity. Let's look at the guidelines in more depth. One, eat the right amount of food. There is not one quote unquote right healthy eating pattern. Calorie needs depend on age, sex, height, weight, and level of physical activity. And we all need to pay attention to portion sizes, especially for foods and beverages that are high in calories, and should focus on hydration by choosing water and unsweetened beverages. Two, prioritize protein foods at every meal. Consume a variety of high quality nutrient dense protein foods such as meats, poultry, eggs, seafood, beans, peas, lentils, nuts, and seeds. Use healthy cooking methods like baking, broiling, roasting, frying, and grilling. The protein goals: 1.2 to 1.6 grams of protein per kilogram of body weight. And this is higher than previous editions that recommended 0.08 grams per kilogram of body weight. 3. Consume dairy. Dairy is an excellent source of protein, healthy fats, vitamins, and minerals. When consuming dairy, include full fat dairy with no added sugar. This is very different from previous guidelines that stressed low fat and skim milk. The serving goals: 3 servings per day as part of a 2,000 calorie dietary pattern. 4. Eat fruits and vegetables throughout the day. Eat a variety of whole, colorful vegetables and fruits. Frozen, dried, or canned vegetables or fruits with no added sugar are also good options. Limit intake of 100% fruit or vegetable juice. The vegetable goals are 3 servings per day, and the fruit goals are 2 servings per day. 5. Incorporate healthy fats. Healthy fats are plentiful in many whole foods, such as omega-3 rich seafood, nuts, seeds, full fat dairy, olives, and avocados. Limit intake of saturated fats from meats, to 10% of total calories. Focus on whole grains. Prioritize fiber rich whole grains. Reduce consumption of highly processed refined carbohydrates, such as white bread, ready to eat or packaged breakfast food options, flour tortillas, and crackers. Whole grain serving goals 2 to 4 servings per day. 7. Limit processed foods, added sugars, and refined carbohydrates. Avoid highly processed packaged, prepared, ready to eat, or other foods that are salty or sweet. Limit foods and beverages that include artificial flavors, artificial preservatives, and low calorie, non nutritive sweeteners. Avoid sugar sweetened beverages and limit use of non nutritive sweeteners. One meal should contain no more than 10 grams of added sugars. 8. Consume alcohol in moderation. No limit is specified, unlike previous guidelines. Alcohol should be avoided completely by pregnant women, those recovering from alcohol use disorder, and those taking medication or having medical conditions that can interact with alcohol. Now let's examine some controversies and concerns. The main controversy, unlike previous editions, the guidelines did not have input from major health and professional organizations before being released. Previously, these organizations had input: the Academy of Nutrition and Dietetics, the American Medical Association, the American Heart Association, and the American Cancer Society. Major concerns: saturated fat. The guidelines has an emphasis on butter, beef tallow, red meat, and full-fat dairy, and this is inconsistent with the recommendation of limiting saturated fat to 10% of total calories. Dairy. The new guidelines do not consider individuals who cannot or choose not to consume dairy products. Low calorie, non nutritive sweeteners. The guidelines emphasize moderation, even though evidence to date indicates they are generally recognized as safe within acceptable intake limits. Synthetic food dyes. Research suggests that only a small subset of children may be sensitive to them. Additional research is needed to better understand the relationship between diet, food additives, and behavior.